Hello, hi, good evening, everyone. Welcome to OET Speaking Speculation. This is me, 𝐒𝐻𝐸𝐾𝐚𝐤𝐬 from Neethu's Academy. So, yes, welcome to another live segment for you guys. So, I hope all of you are staying safe and healthy and your preparation is going really well as well. So, yes, today I'm back with another exam model card discussion for you guys. So, I hope all of you are preparing based on the proper strategy that is really going to be helpful for your examination. And I really believe that, as I always say, you're practicing the materials which are really exam oriented or exam based or exam modeled. So make sure that whatever you're practicing, you're familiar with these concepts. Okay, അങ്ങനെ നിങ്ങൾ പ്രാക്ടീസ് ചെയ്യും തോറും when you go for the examination, things will get really easy for you. So you won't find very difficulty or any difficulty to do the tasks or perform the role play or anything like that. So it will be so easy for you. So please make sure that you're practicing the materials based on the context or the concepts that you can expect for the examination. So how do you understand what are these? So you can join this speaking speculation live, and you can join this speaking clip which we are providing from here, in which we do discuss the recent exam model cards and make sure that the students are thorough with the concept or with the exam model or the concepts or the context that can be expected for the examinations. So please make sure that you always practice these types of materials and train yourself. Okay, so yes, so today we'll be doing a community health center. And in this context, we have a 62-year-old patient, and the patient has been diagnosed with vitamin B12 deficiency. The patient is visiting to get more information about this particular thing. So you are giving details about what to do, what can be done. അങ്ങനത്തെ കാര്യങ്ങളൊക്കെ പറഞ്ഞു കൊടുക്കുന്നു. So usual information, gathering, information providing, giving advice, reassuring, these kind of ഒരു pattern ആണ് വന്നിരിക്കുന്നത് കേട്ടോ. അപ്പോൾ എപ്പോഴും നമ്മൾ ഒരു കാർഡ് ചെയ്യുന്ന സമയത്ത് എന്താണ് ഇതിൻ്റെ ഒരു സ്ട്രക്ചർ, ഓക്കെ, അതിൻ്റെ സ്കെലിറ്റൺ എന്താണ്, എങ്ങനെയാണ് ഇതിൽ വന്നിരിക്കുന്ന ടാസ്കുകളുടെ ഒരു നേച്ചർ, ഒരു ഫ്ലോ ഓഫ് കോൺവെർസേഷൻ എന്നുള്ളൊരു കാര്യം മനസ്സിലാക്കാനായിട്ട് ശ്രമിക്കുന്നത് വളരെയധികം നല്ലതാണ്. കാരണം ഇങ്ങനത്തെ പാറ്റേൺസ് വന്നാൽ ഈ ഒരു ഓർഡറിലായിരിക്കാം ടാസ്കുകൾ പോവുക. അപ്പം ഇങ്ങനത്തെ ടാസ്കുകളായിരിക്കാം കൂടുതലും കാണപ്പെടുക എന്നുള്ള കാര്യങ്ങളൊക്കെ കുറച്ചുകൂടെ ഫെമിലിയർ ആവാനും, അങ്ങനെ ഫെമിലിയർ ആവുമ്പോൾ കുറച്ചുകൂടെ കോൺഫിഡൻ്റ് ആയിട്ട് സംസാരിക്കാനും നമ്മളെ ഹെൽപ്പ് ചെയ്യുന്ന കാര്യങ്ങളാണ് ഈ ഒരു അണ്ടർസ്റ്റാൻഡിങ് എന്ന് പറയുന്നത്. സോ ഓൾവേസ് മേക്ക് ഷ്യൂർ നിങ്ങൾക്കൊരു കാർഡ് കിട്ടിക്കാനുള്ള കാർഡ് എങ്ങനെ ചെയ്യണം എന്നതിനേക്കാളും അതിൻ്റെ ഒരു പാറ്റേൺ. യെസ്, ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ടു അണ്ടർസ്റ്റാൻഡ് ഹൗ ടു ഡു ദ ടാസ്ക് വിച്ച് ഇസ് ദെയർ. ഐ ടോട്ടലി അഗ്രി വിത്ത് ഇറ്റ്. ബട്ട് അറ്റ് ദ സെയിം ടൈം പാരലലായിട്ട് നിങ്ങൾ കൺസിഡർ ചെയ്യേണ്ട ഒരു കാര്യമാണ് എങ്ങനെ ഈ കാർഡ് നമുക്ക് പ്രസൻറ്റ് ചെയ്യാം എന്നതിൻ്റെ ഒപ്പം തന്നെ എന്തൊക്കെയാണ് ഇതിൻ്റെ വന്നിരിക്കുന്ന ഒരു പാറ്റേൺ, ഏതൊക്കെ ടാസ്കുകളാണ് ഇതിൽ ഇവർ ഇൻക്ലൂഡ് ചെയ്തിരിക്കുന്നത്, ഏതൊക്കെ ആക്ഷൻ വെർബ്സ് ആണ് ഇൻക്ലൂഡ് ചെയ്തിരിക്കുന്നത്, കീവേഡ്സ് ഏതൊക്കെയാണ് വന്നിരിക്കുന്നത്, ഏതൊക്കെ ടൈപ്സ് ഓഫ് നേച്ചർ ഓഫ് ടാസ്കുകളുണ്ട്, അതായത് ഇൻസ്ട്രക്റ്റീവ് ടാസ്ക് ആണോ അല്ലെങ്കിൽ എഡ്യൂക്കേറ്റീവ് ടാസ്ക് ആണോ ഇൻഫർമേറ്റീവ് ടാസ്ക് ആണോ, എന്തൊക്കെയാണെന്നുള്ളത് മനസ്സിലാക്കുക. ഇനി ഇതിൽ തന്നെ അവർ യൂസ് ചെയ്യുന്ന ഒരു പർട്ടിക്കുലർ പാറ്റേൺ, ഇപ്പോൾ സേ ഫോർ എക്സാമ്പിൾ ട്രാൻസിഷൻസിന് ഡിഫോൾട്ട് ട്രാൻസിഷൻസ് തരുന്നുണ്ടോ, അതോ അങ്ങനെ ഇല്ലാതെ നമ്മൾ തന്നെ ട്രാൻസിഷൻസ് എപ്പോഴും ഇടേണ്ട ടൈപ്പ് ഓഫ് കാർഡുകളാണോ ഇപ്പോൾ കോമൺ ആയിട്ട് വരുന്നത്, ഇങ്ങനത്തെ കാര്യങ്ങളൊക്കെ മനസ്സിലാക്കാം. ഇതെല്ലാം ഒരു അണ്ടർസ്റ്റാൻഡിങ് ഉണ്ടെങ്കിൽ തന്നെ നിങ്ങൾ എക്സാമിന് പോകുമ്പോൾ നിങ്ങൾക്കും അത്യാവശ്യം നല്ല രീതിയിൽ തന്നെ ഓക്കെ ഇങ്ങനത്തെ ഒരു നേച്ചർ ആണെങ്കിൽ ഇതാണ് ഇതിൻ്റെ ഫ്ലോ എന്നുള്ളൊരു ഓർഗനൈസേഷൻ നല്ല ഈസി ആയിരിക്കും. You do not have to put that extra effort or struggle too much to understand what exactly is the context or to bring out an extra organization into that. It will be natural, it will be organic, and it will be very easy for you. So make sure whenever you get a card, you already understand എങ്ങനെയാണ് ചെയ്യേണ്ടതെന്നുള്ളത് നമ്മൾ മനസ്സിലാക്കുന്നുണ്ട്. അതിൻ്റെ ഒപ്പം തന്നെ എന്തായിരുന്നു ഇതിൻ്റെ ഒരു സ്കെലിറ്റൺ, ഓക്കെ, എന്തൊക്കെയായിരുന്നു ഇതിൻ്റെ ഒരു പാറ്റേൺ ആയിട്ട് വന്നത്, ഏതൊക്കെ ആക്ഷൻ വെർബ്സ് വന്നിട്ടുണ്ടായിരുന്നു എന്നുള്ള രീതിയിലൊക്കെ ഞാൻ നേരത്തെ പറഞ്ഞ കാര്യങ്ങളൊക്കെ തന്നെ നോക്കുക, ആ ഒരു കാര്യം മനസ്സിലാക്കുക. പിന്നെ നിങ്ങൾ ചെയ്യുന്ന കാർഡ്സുമായിട്ട് ഇതിന് താരതമ്യം ചെയ്ത് നോക്കുക. നേരത്തെ നോക്കിയ അതിൽ ചെയ്ത കാർഡുമായിട്ട് ഇതിനെന്തെങ്കിലും ഒക്കെ ഒരു സിമിലാരിറ്റി ഉണ്ടോ, പാറ്റേൺ റെപ്പറ്റേഷൻ വരുന്നുണ്ടോ, കോണ്ടെക്സ്റ്റ് സ്ട്രക്ചറൊക്കെ സെയിം തന്നെയാണോ എന്നത്തെ കാര്യങ്ങളൊക്കെ നിങ്ങളൊന്ന് നോക്കുക. ഓൾമോസ്റ്റ് സിമിലർ ആയിരിക്കും. അങ്ങനെ വരുമ്പോൾ ഏതൊക്കെ സെൻറ്റൻസസ് എവിടെയൊക്കെ എങ്ങനെയൊക്കെ പറയണമെന്നുള്ള കാര്യമൊക്കെ നിങ്ങൾക്ക് അത്യാവശ്യം നല്ല രീതിയിൽ അറിയാമെന്നുണ്ടെങ്കിൽ നിങ്ങൾക്ക് വളരെ നല്ലോണം തന്നെ സംസാരിക്കാനായിട്ട് സാധിക്കും. ബിക്കോസ് ദ മോർ കോൺഫിഡൻറ്റ് യു ആർ, the more good presentation you can give. Okay, so always remember this. So yes, good evening everyone. I hope all of you are doing good. Good evening all of you. So without wasting much time, I'll share the card right now for you guys. Remember, you have 3 minutes to prepare it. After that, we will discuss each point which is mentioned here. Okay, so over to the screen, you have 3 minutes. Welcome back, everyone. So I hope all of you have gone through the points, got an idea about how this card can be done, and I hope you're prepared very well as well. Okay, so let's start with the discussion. Starting from the setting, it is given as a community health center, and the background information says you are seeing a 62-year-old patient who has been diagnosed with vitamin B12 deficiency. He or she is visiting for more information about vitamin B12 deficiency. And your first task says, confirm the purpose of the visit, review of symptoms, current status, and any recent changes. After that, find out about how the patient is feeling, fatigue, numbness, or tingling. So you have so many information given here. From this, you need to understand whether it is a known case or an unknown case. So could you please comment and let me know what type of context is this? Is it a known case or an unknown case? Or if it is confusing and if it is difficult for you to find out which context it is, let me know in the comment section confusing. So I can explain to you what context it is and how to identify that. Yes. Yes, good evening Vincent, Shilpa, Adura, good evening, good evening. Let me know in the comment section please, what context is this? What do you think? Yes, Adira, Vincent, Shilpa, please comment. What do you think is this context? And how will you start this role play? Like, what is the opening statement for this particular role play? Do you think it is a known case or an unknown case? Just because it is given, confirm the purpose of the visit, do you think it has to be considered as a known case? Or since it is not mentioned whether we know this patient or we have spoken to this patient before, should we take it as an unknown case? How will we deal with this? So Adira has mentioned it is an unknown case. Swarupa has mentioned it is a known case. Okay. Anshu has mentioned it is an unknown case. I'm getting different opinions here. Okay. Fine. I understand that most of you will have different opinions for this context. I'll explain to you how it can be done, but I would definitely love to see from your end what you think is this context. So Adira has mentioned it is unknown. Okay. Vincent mentioned it is unknown. Okay. Then what else? Your first task is confirm the purpose of the visit, review of symptoms. So how would you do that? Is it a known case or an unknown case? I'm getting a lot of unknown cases and just one person has mentioned it is a known case. Aji has mentioned it is unknown. Okay, could you guys also tell me why do you think it is an unknown case? And the one who has mentioned it is a known case, could you tell me why do you think it is a known case? So it will be more clear for everyone to understand. And it's absolutely fine if it is wrong, because we learn from our mistakes, so you don't have to worry about making a mistake here, okay? Shilpa has mentioned it's a semi-non, so you have to do the verification and you have to ask, could you please tell me your name? Okay, fine. Any other opinion? Yes, Hadiza, what do you think? Those who have commented known and unknown, please let me know the reason why you said so. Why you said it is unknown, why you said it is known. Yes. Yes, can I please get a reason as to why it is unknown and why it is known according to you? And then I'll start with my explanation and tell you what the exact context is here. So Swarupa has mentioned, I think it's a non-case because of the community health center. Okay. I just need to make a clarification here. We do not look at this setting to confirm a non-case or unknown case, because that just tells you where this conversation is taking place. In order to get a clarity on that, you need to read the background information. Okay, the only setting that tells you this is a non-case is ward. If it is a ward or kind of like, intensive care unit, etc., or recovery room, observation room, these types of context gives you an idea like, okay, the patient is with us. So that is 100% non-case. But other than, these types of settings, you cannot look at the setting and decide whether it is a non-case or unknown case. So Adira has mentioned it is an unknown case from the first task. Vincent mentioned it is the first task is confirmed. Okay. Alright, so let me just give you an idea about what exactly this context is, okay? So most of you told me this can be treated like an unknown case. So if you're doing it like an unknown case, you will shift it to a known case very quickly, okay? So say for example, you're treating it like an unknown case. So how will you start? You will start by saying, good evening. My name is Adida. I am one of the registered nurses working in this community health center. How can I help you? This is your opening statement, isn't it? So the patient will tell you, hi, my name is Henry. I'm 62 years old and I've been recently diagnosed with vitamin 12 deficiency. I'm here to get more information about that. Okay, so then you'll have to have a trouble to do the first task. The first task will be like, you have to confirm the reason for the visit, review of symptoms. So then you'll have to come up with a very good statement like, okay, yes, so you told me your name is Henry. Okay, Henry, from my system, I can see that you've been recently diagnosed with vitamin 12 deficiency and today you are here for a review of your symptoms. Am I right? Then you'll have to be coming up with a statement which is fitting into that context. If you're doing it like this, it's okay if you start it like an unknown case. Absolutely fine. Make sure your response to the reason for the visit given by Mr. Henry should be an answer to your task 1. If that is neatly done, then no problem. In other words, or on the other hand, if you're treating it like a non-case, you just need to ask the name of the patient during 3 minutes preparation time, or just leave it also, no problem. If, say for example, you ask the name of the patient, to be on the safer side, it is the easiest method. So you ask the name of the patient. So you can start like this. Hi, good morning. My name is Adida. I'm one of the registered nurses working in this community health center. Are you Mr. Henry? So Mr. Henry says, yes, I am. Mr. Henry, I believe you're here for a review of your symptoms. That's how you can do it. This method makes it very easy, and also it is very direct to the context that you have. So that is more and more convenient for you to deal with. So I hope it's clear. So the first method of dealing it like an unknown case is also okay, because nowhere it is mentioned the patient is admitted or it is a referral or the doctor has advised you to talk to the patient. So we don't have much information about this. Is definitely a non-case, right? The only area which tells it is a non-case is the word review, because that tells you the patient has come again to discuss with you. So that is how you deal it with it. So you do not have to confuse too much about this. If you're dealing it like an unknown case, it's absolutely fine. But your response to the reason for the visit of the patient should be the answer to your task number 1. You should act like, oh yes, Mr. Henry, I know that you have a review today, isn't it? You should be able to connect it with your task number 1. If you're doing it like that, absolutely fine, good to go, no problem. But if you're not able to come with spontaneous statements, these types of context can be dealt as a non-case, where you do the verification and then you do task number 1. So I hope it's clear to you guys. So if you have any confusions, let me know in the comment section. So Adira has mentioned it's clear. So I hope everyone is clear with it right now. Okay. So now let's look into the first task entirely. You have too many informations there. The first is review of symptoms, current status, any recent changes. So altogether, you can just come up with one word for this. You're here for a review, or you're here for a assessment of your progress, isn't it? Or you're here for a follow-up checkup. That's also fine, because all these points, the current status, any recent changes, everything is understandable from a single word, which is follow-up. Why do we have follow-ups? We do have follow-ups to check whether everything is all right, or whether everything is going as expected, whether the treatment is going well. So you do not have to explain each and everything here and waste your time. Logically speaking, if you say the word for a follow-up or an assessment or a review, it is understandable that it includes all these things. Okay, so that is how we can do it. The next point is find out about how the patient is feeling. So I've always told you, whenever there is an activity that is mentioned in the card, like you are meeting the patient for this, the patient is meeting you for this. So there is an activity, say for example like this. It's a review. Review is an activity. Or if it is a suture removal, removing the suture is an activity. Or if it is preparing the patient for a surgery, preparation is an activity. So whenever there is an activity mentioned like this and you're telling the patient, this is why I'm here, or this is why we're having this conversation, and then suddenly you have to ask how the patient is feeling or whether the patient has followed everything correctly, you need to connect it. Okay, you need to have a connection between the first line that means your first dialogue and your second dialogue, which is going to be the one which we are going to do right now, asking how the patient is feeling. So there needs to be a connection in between. So you can say something like, so before we start, and what are we going to start? The review. Okay, so before we start with the review, I would like to know how you have been feeling. Okay, do you experience any fatigue, numbness, or tingling? That is how we can ask that question. So before we start with the review, I would like to ask you how you have been feeling so far, or how you have been feeling lately. Do you experience any fatigue, numbness, or tingling? That's how you will frame that question. It's as easy as that. Always remember, when there is a transition like this, when you are actually telling the patient this is the reason why I'm here and there is an activity to be done, you have to have a connection to the next point before we do that, or before we get into it, or before I start to remove your sutures, or before I start assessing your wound, or before I start with the examination, or before I start with the review, I would like to ask you this question. So that is how you will do it. Okay, now the next point is explore the patient's understanding of vitamin B12 deficiency. So this task is a different pattern. Yes, it is information gathering, but there is more specification for this particular task, which is exploring the existing knowledge of the patient. Yes, so here you're asking the patient what the patient already know, or the patient's level of understanding of the present situation of the patient. So this is called checking the patient's understanding or checking the patient's existing knowledge. So you have to be particularly telling the patient, well, I need to make sure, or I would like to know. You have to signpost. Okay, so Mr. Henry, I need to ask you a question. So you have to signpost and then do the task. So can you guys comment down a sentence which is suitable in this context and how you can construct a question to ask the existing knowledge of the patient? Please go ahead and comment down. Yes, how would you do it? What could be an appropriate start that you can have for this context, as in for that particular line? A question, please. Yes, I'll give you 30 seconds time. Please make sure that you comment down. Explore the patient's understanding of vitamin B12 deficiency. How would you do it? Give me different statements. So when you come up with different statements in the comment session, everyone will understand the different versions of doing it. So you do not have to repeat the same questions. You can try the different versions. Yes. How would you do it? Explore the patient's understanding of vitamin B12 deficiency. It's a very simple and a common question that we always use whenever we have to check the existing knowledge of the patient. How do you do it? Either you can start like, could you please tell me what do you understand about vitamin B12 deficiency? Or could you please tell me about your understanding of vitamin B12 deficiency? All these are different questions you can try, okay? So the questions that I created right now, both of them are from the very on task that you can see here. Okay, ഇവിടെ തന്നിട്ടുള്ള ആ ടാസ്ക് എങ്ങനെയാണോ ഉള്ളത് അതേപോലെ തന്നെ അതിൽ നിന്ന് വാക്കുകളൊക്കെ ഉപയോഗിച്ച് സെൻറ്റൻസ് കൺസ്ട്രക്ട് ചെയ്യുന്നതാണ് അല്ലേ. സോ ദാറ്റ് ഇസ് ദി ഈസിയസ്റ്റ് വേ. ഐ ഓൾവേസ് ടെൽ യു ദിസ് ഇസ് ദി ഈസിയസ്റ്റ്. സോ ഇഫ് യു ആർ എ പേഴ്സൺ ഹു ഹാവ് ബീൻ കോൺസ്റ്റൻ്റ്ലി വാച്ചിങ് ദ ലൈവ്, യു നോ ഐ ഓൾവേസ് സപ്പോർട്ട് സെൻറ്റൻസ് കൺസ്ട്രക്ഷൻ വിച്ച് ക്യാൻ ബി ഈസിലി ഡൺ. സോ ദാറ്റ് ഈസ് ഹൗ യു ക്യാൻ ഡു ഇറ്റ്. So Jovita has mentioned, well, Mr. Henry, what's your understanding on vitamin B12 deficiency? Beautiful. That's a great question. Mister, do you know anything about vitamin B12 deficiency? Excellent. Yes. So the one which Adira mentioned is a very common question that is familiar to everyone. And what Jovita has mentioned is a very little bit of an advanced version of the common statements. What's your understanding of vitamin B12 deficiency? Both are on the same level, but the one which Jovita said is not commonly used, but which Adira mentioned is commonly used. Okay, so you will be very familiar with both of these statements. Alright, do you know anything about vitamin B12 deficiency and what's your understanding on vitamin B12 deficiency? See the two different sentence constructions for the same context. So this is how you can explore it. Okay. So after that, you're going to ask the patient awareness of condition, potential causes, previous discussions with doctor. Okay. So you could add the bracket information also to expand the question. So Manuel has mentioned, I would like to know how much knowledge you have about vitamin B12 deficiency. Yes, it's instead of I could, change that to I would. Okay, I would like to know how much knowledge, instead of knowledge, how much you know about vitamin B12 deficiency, or how much knowledge you have about is also fine, but little more direct with the patient could be how much you know about. Okay. Yes. So how can you construct a statement using the bullet points? Awareness of condition, potential causes, previous discussions with doctor. How would you ask that also? Yes. How could you collaborate those information given in the bracket along with the topic statement, which is understanding of vitamin B12 deficiency, the one which you three have commented right now. How would you incorporate the other information also? Could you please tell me how much do you know about vitamin B12 deficiency? Like the awareness of the condition, its causes. Did you have any previous discussion with the doctor? So you can ask these three things together like that. Okay. So remember, when you ask the last one, previous discussion with the doctor, you need to have a rising intonation because that indicate you're trying to have a question there. So when your voice is going up for the last word of the sentence, that means you're raising a question. That's how you'd make it understandable for the listener that you're raising a question, so that person will answer you. Okay. So that's how you can do it. So I'll just go through that one more time. I'm just using the statement which Manuel has commented right now. So I would like to know how much knowledge or how much you know about vitamin B12 deficiency, like your awareness of the condition, the potential causes, and did you have any previous discussions with the doctor? So that's how you can do it. Okay. After that, when the patient tells you, well, I do know a little bit about it. The doctor did mention to me what is vitamin B12 deficiency, but could you please explain from your end as well? I would like to have more clarity on it. So what could be a good reply to this? Please let me know a good reply in the comment section. When the patient told you, yes, the doctor did explain a couple of things to me. I heard everything what the doctor said, but it would be good if you can also explain that to me so it will be more clear. Okay, so what will be a good acknowledgement statement? And definitely you need to acknowledge before you push on to the next one. So what will be a good acknowledgement statement that you can use in this context? Yes, let me know in the comment section, please. How would you acknowledge in this context? Yes. How can you do that? What is going to be a good acknowledgement? Let me know in the comment section. Okay. So Manuel has mentioned it's a valid concern you have told. Okay. Any other sentences? All right. When the patient actually raises a concern, in my personal opinion, it would be really good if you try the 𝐒𝐸𝐞 method, okay? Instead of simply saying, I understand your concern, or that's a good question from your end, you can try something like, Mr. Henry, I understand you would like to hear about vitamin D deficiency. Don't worry, let me explain that to you. Or you can say, I understand you do have some questions about your present situation. Don't worry, I'll explain everything to you. So when Mr. Henry actually raises the concern, like, yes, I heard the doctor said, what the doctor said, but I would like to hear what you have to say. In Mr. Henry parayumpo, that means കുറച്ചുകൂടി ഇൻഫർമേഷൻ ഒക്കെ കിട്ടിയാൽ കൊള്ളാം എന്നുണ്ടെന്നാണ് അല്ലേ. സോ വാട്ട് യു കൻ ഡു ഇസ് യു കൻ ട്രൈ ദ എക്കോയിങ് മെത്തേഡ് ആൻഡ് സേ, മിസ്റ്റർ ഹെൻറി, ഐ അണ്ടർസ്റ്റാൻഡ് ദാറ്റ് യു ഹാവ് സം ക്വസ്റ്റൻസ് അബൌട്ട് യുവർ പ്രസന്റ് സിറ്റുവേഷൻ. സോ ലെറ്റ് മി മേക്ക് ഇറ്റ് റിയലി ക്ലിയർ ടു യു and you can start explaining it. Okay. So Adra has mentioned, no need to worry, Mr. Henry. I will explain all regarding this condition. Yes, that is very simple and direct to the context. That is also very nice. Okay. So let's see how we can construct the statement here. So vitamin B12 is very important for the nerve function and for the red blood cell production. And there are some consequences if you have vitamin B12 deficiency. It includes neurological problems, and it can even lead to anemia and constant fatigue. I would also like to talk to you regarding the causes of vitamin B12 deficiency. Dietary insufficiency, malabsorption due to certain conditions like anemia, gastritis, or any surgery can be a main cause for vitamin B12 deficiency. I hope it's clear to you. So I'll just explain that one more time. I actually constructed the statement with the easiest of connections that you can try in this context. So let's go over that one more time. Listen very carefully and look at the task as and when I'm reading. Okay? Let me explain to you the importance of vitamin B12. It is essential for nerve function and red blood cell protection. And there are certain consequences if you have vitamin B12 deficiency. It includes neurological problems. It can lead to anemia and constant fatigue. So I hope it's clear to you. Moreover, I would like to talk to you about I would like to give you some information about the causes of vitamin B12 deficiency, dietary insufficiency, malabsorption due to conditions like anemia or gastritis, or if you have undergone any surgery, there could be a possibility it can lead to vitamin B12 deficiency. So I hope you understand everything about this present situation that you have, or I hope you understand everything about vitamin B12 deficiency. Okay, so this is how we can easily create a statement in this context. Okay, so Adra has come up with another statement. Vitamin B12 is essential. It is an essential vitamin. It helps in nerve function, red blood cell protection. Yes, you just need to add that in after helps. Okay, other than that, it is good. So this is how we'll do it. And since it is an information giving task, what will you do? ആ ടാസ്കിന് ശേഷം നമ്മൾ എന്ത് ചെയ്യണം? ഇൻഫർമേഷൻ അങ്ങോട്ട് കൊടുത്ത ടാസ്ക് ആയതുകൊണ്ട് യു ഹാവ് ടു ചെക്ക് വെദർ ദ പേഷ്യൻറ്റ് അണ്ടർസ്റ്റുഡ് വാട്ട് യു ഹാവ് സെഡ്. നിങ്ങൾ പറഞ്ഞ കാര്യം പേഷ്യൻറ്റിന് മനസ്സിലായോ എന്നാണ് നമ്മളിവിടെ ചെക്ക് ചെയ്യേണ്ടത് അല്ലേ. സോ ഈസ് ദാറ്റ് ക്ലിയർ ടു യു? Or I hope you understand everything about vitamin B12 and the consequences of deficiency. Then you can come up with a transition when the patient says, yes, I understand that. Then you can move on to the next point. Well, in that case, when the patient says, yeah, I understand that, നമുക്ക് എന്ത് പറയാം? അങ്ങനെയാണെങ്കിൽ, well, in that case, I would like to discuss the treatment options and management to you or with you. We have to start with B12 injections along with oral supplements and make some dietary changes to address the underlying causes. And along with that, we have to address the underlying causes. Okay. After that, you can say, do you have any questions or concerns? So in between, do you have any questions or concerns and the task explanation, you need to come up with one more reassuring line, something like that. So you can say, please don't worry, you are in safe hands. We will do the needful to help you, or we will help you with the most comprehensive care and management. So please set your mind at ease. Anything like this would be fine. And then you can ask, do you have any other concerns or questions? Then the patient asks you, Yes, I am really concerned about my present situation. I'm really concerned. Told me the consequences I can have if I have vitamin B12 deficiency, and it's actually worrisome. Then you're going to reassure the patient. And what is your reassuring point here? The prognosis is generally good. That means the outcome is generally good. In this case, it is not going to have usually it has a generally good outcome. We need ongoing monitoring, and you must need or you might require long-term management. But please do not worry. We will be there to support you throughout your journey, or we will be there to help you in every step of your journey. Please do not think you're alone. We are all there to support you here. Support you and guide you. Okay. So these are the different sentences or types of reassuring points that you can incorporate into these type of contexts. So I hope you got an idea about it. After that, you can ask the patient, having said that, I would like to schedule a follow-up appointment for you in 3 weeks time. So please make sure that you come here and do the follow-up, and based on that we can do the needful. Okay, so that's how we can do the last point. So the patient says, yeah, that's okay with me. I will definitely come for the review in 3 weeks. So you can say, well, I'll see you in 3 weeks time. So as I told you, please don't worry. Make sure that you follow the instructions correctly. And in case of any emergencies or any help that you require, feel free to contact us anytime. So Mr. Henry, I'll see you in 3 weeks. This is how you can do this point, or this is how you can conclude this context. Always remember, whenever you have some activities mentioned towards the last, like consult a doctor, or wait to see the doctor, or prepare the patient for the surgery, or or dress the wound, or like give an appointment, book an appointment, etc., etc. What you have to do is conclude it according to that context. If it is suture removal, you can say, so please wait here. I will make the arrangements to remove your suture. Or if it is preparation of the surgery, you can say, well, I hope everything is clear to you. So please be relaxed, or please lie down straight, or please sit upright. I will prepare you for the surgery right now. Okay. Or if it is like you are handing over a brochure to the patient, so you can say, well, I'll get a brochure for you. Please wait here. Or if it is a review like this, and if there is a time frame which is mentioned, you can give a conclusion like, I'll see you in 1 month, or I'll see you in 2 weeks. In this case, it is 3 weeks. So you can say, I'll see you in 3 weeks time, Mr. Henry. Okay, so that is how you can make your conclusion alike the same context that you've been dealing with. So always make sure there is a connection. It shouldn't be like two strange things that is there. There should be a proper connection between the context that you have been dealing with and the conclusion that is mentioned on the card. Okay, so this is the entire organization of this card. I hope it's clear to everyone. Any questions? If you have any questions, എന്തെങ്കിലും ഡൗട്ടോ മനസ്സിലാവാത്തതോ കൺഫ്യൂഷൻസോ ഉണ്ടെങ്കിൽ please let me know in the comment section. I'll definitely explain that to you. All I have to say is, whenever you practice, make sure that you're practicing with exam model cards. Okay, the more you do that, the more easier and confident you get. Okay, trust me, because whenever you see a lot of cards like this, familiar contexts like this, examine പോകുമ്പോൾ നിങ്ങൾ ഭയങ്കരമായിട്ടും നെർവസ് ആവില്ല, because you've been practicing these types of context and you're familiar with these words, you're familiar with the pattern. ഇതിൽ വരുന്ന വാക്കുകൾ ഇപ്പോൾ എക്സ്പ്ലോർ, കൺഫേം, ഇങ്ങനത്തെ വാക്കുകളൊക്കെ എക്സാമിന് വളരെ കോമൺ ആയിട്ട് വരുന്ന ടേംസ് ആണ്. So if you're very common with or familiar with these types of words or the type of tasks you have here, കുറച്ചുകൂടി ഈസി ആയിരിക്കും നമുക്ക് സംസാരിക്കാനായിട്ട്. Okay, so always remember to practice it like that. Okay, so yes, thank you very much everyone for this wonderful cooperation. So I would like to tell you one happy news. From this week onwards, we will have 2 live segments for OET Speaking Speculation, which will be on Tuesdays and Wednesdays at 5:30 p.m. That's the timing that we have, Tuesday 5:30 and Wednesday 5:30. So on Tuesdays, we'll have a card discussion like this between you and me, guys. And on Wednesdays, we'll have a card discussion and a role play presentation as well. So you will get to see how the card that we have discussed can be presented as well. Okay, so please don't miss the live segments. Make sure that you're staying tuned to watch the lives on Tuesdays and Wednesdays at 5:30 p.m. Okay, so I'll see you guys tomorrow. Until then, take care. Bye bye, all of you.